Hello again, I'm Dr. Nev and I'm a licensed psychologist. This is part 4 of my 10-part series of techniques you can use to help you manage your anxiety. As I mentioned in parts 1, 2, and 3, I frequently utilize these techniques with my clients in private practice, and I hope you will find them to be useful as well. Just a quick disclaimer before we start, these videos are not substitute for professional mental health services. I am not your therapist and you're not my client. And if you are experiencing significant distress, please contact your local psychologist. In the first 3 videos, we discussed mindfulness and sensation-based techniques for managing your anxiety. In the next several videos, we're going to focus on cognitive or thought-specific techniques for alleviating anxiety. Psychological researchers have found that by helping clients monitor and challenge their thoughts, their feelings also change for the better. The first technique I wanted to speak to you about is probability versus possibility technique. So with this particular technique, what I teach clients to do is look at the possibility versus probability. So for example, is it possible that space aliens are going to come to Earth and take over everything tomorrow? Yeah, I suppose it's possible, but is it probable? In other words, what is the likelihood of that actually taking place? Oftentimes when people get anxious, they overestimate the probability of something occurring, and as a result, they tend to feel anxious and more anxious and more anxious, until their heart starts to race and they start to feel like they're losing control. One quote that I'm often reminded of is, I believe, by Mark Twain, and it says, "I am an old man and have known a great many troubles, but most of them have never happened." So with this particular quote, it kind of goes to illustrate that just because something is possible and we may create a story in our head about it, doesn't mean that it's actually likely to ever take place. So take a second and really think, how many of the anxious thoughts that you've had over the past year have actually come to pass? How many of those catastrophes and crises have actually occurred and happened to you? My guess would be probably not as many as you've had. The second technique I wanted to talk to you about ties in nicely to this conversation, and it's about the irrational thinking mechanism of catastrophizing. So when we are catastrophizing, we're looking at the worst case scenario of something happening. So for example, I had a client back in the day who was very, very anxious, and one day her daughter did not call her. And she was used to her daughter calling her, and the daughter just simply never called. So what this client ended up thinking is that her daughter must have died, she must have been in a car accident. She created this whole story, this elaborate story of her daughter's death and demise, and ended up experiencing a panic attack and ended up in the ER. And I'm not laughing because it's funny. I am kind of having a reaction because of how absurd it might sound that somebody would go from point A to point B. Somebody doesn't call, so they must be dead. Doesn't really connect, doesn't make a whole lot of logical sense. And this was a really good and important experience for me and my client to process and to really recognize that sometimes the worst case scenario is just as likely as the best case scenario. And thankfully in this particular story, the daughter was fine. I can't even remember what the reason is why she didn't call her mom, but she was healthy and live and well. I also want to mention that it might feel pretty impossible to control and challenge your irrational and catastrophizing thoughts at first because they become so automatic that you might not even realize that you're having them. You may accept certain things and as just simply as truth, and you might stop questioning them over time. So the key is to really catch some of these automatic catastrophic assumptions as they happen, and then assess if there is really any truth to them. And are they really likely to happen? Just because they're possible doesn't mean they're likely. In other words, if you were a judge, would your anxiety-provoking automatic thoughts really hold up in the court of law? What evidence are those thoughts based on? And how solid is that evidence really? One way to examine if your thoughts are based on logic is to say them out loud. So for example, if something is troubling you or causing you anxiety, just talk it out loud to yourself. Sometimes thoughts might make perfect sense in your head, but when you speak them out loud, you realize how absurd they actually sound. So my mantra is, when in doubt, talk it out. My favorite place to do this is in my car on my way to and from work. I want to thank you so much for watching part 4 of my 10-part series on anxiety management. If you like this video, I hope you will also check out part 5. Please subscribe if you would like YouTube to alert you anytime I post a new video. Thank you so much and take care.